It is genetic. Take this pill for life. Salt is the cause of. Why is the set point elevated? Is there metabolic stress? Genes load the software, but lifestyle runs the program. It's not a static trait you have, it is a regulated variable your body creates every second. Doctors give millions of people the same 3 lines of advice for high blood pressure. It is genetic, just take this pill and cut the salt. But what if most of that advice misses the real problem and keeps you sick longer? In this video, I'll show you the real mechanics behind high blood pressure, why your genes are not your fate, and why salt is not the villain you think it is, and how hormones, insulin resistance, and stress signals actually steer your numbers. By the end, you'll know which common tips to ignore, which ones actually work, and the exact taste and lifestyle moves I use with patients to fix the root cause, not just the numbers. Let us debunk the worst blood pressure advice and get practical. Quick note, this is educational only, not medical advice. Hi, I am Nicholas, a pharmacy practitioner. I explain how medicines and physiology work so you can ask better questions of your clinician. Myth number 1, it is genetic, your dad had it, so you will too. That one sounds final, but it is incomplete. Yes, you inherit genes, but whether and how those genes express depends on epigenetics, your lifestyle, diet, movement, stress, toxins, sleep, the things that flip genes switches on and off. In short, genes load the software, but lifestyle runs the program. Many people mirror their parents' habits, posture, food, stress responses, thanks to brain wiring like mirror neurons. So, the family pattern often reflects learned behavior, but not immutable fate. Before we go deeper, let us be clear on the categories you'll hear: normal, elevated, stage 1, stage 2, and severe or crisis. Stage 1 high blood pressure has a systolic reading of roughly 130 to 139 and a diastolic reading of 80 to 89 milligrams per mercury, while stage 2 has a systolic reading of greater than 140 and a diastolic reading of greater than 90 milligrams per mercury, and readings higher than 180 over 120 milligrams per mercury may indicate an emergency. If your pressures are repeatedly high, treat them, but context matters, okay? Myth number 2, take this pill for life. Medications save lives, they prevent strokes and heart attacks, but they don't always fix the underlying reason the body is keeping your blood pressure high. Blood pressure is not a static trait you have, it is a regulated variable your body creates every second. If it is chronically high, something in your body's regulatory system is out of balance. We should ask, why is the set point elevated? Is the kidney signaling off? Is there metabolic stress? Is the nervous system chronically in fight or flight? Medication can be an appropriate and life-saving tool, but it is often part of a plan that also addresses root causes. One of the most powerful ways the body controls long-term blood pressure is called pressure natriuresis. Essentially, when arterial pressure rises slightly, the kidneys respond by excreting more sodium and water, thus lowering blood volume and pressure. This mechanism is so powerful that it normally holds blood pressure near a set point, so chronic hypertension usually means this system is impaired. Myth number 3, salt is the cause of high blood pressure. The truth is more than subtle. Salt raises blood volume and can raise pressure, and many people are salt sensitive, but the body has hormonal and renal system to handle sodium. In healthy individuals, extra sodium is usually compensated for. But in people whose regulatory systems are broken, e.g. kidney diseases or severe insulin resistance, salt can make things worse. For most people, reducing processed foods helps, but salt alone is not the whole story. Now, the big driver most clinicians underplay, metabolic dysfunction, especially insulin resistance. Hyperinsulinemia promotes sodium retention and multiple pathways that raise blood pressure, that is inflammation, oxidative stress, vascular stiffening, and kidney signaling changes. Studies and reviews link insulin resistance directly with high blood pressure and salt sensitivity. That's why fixing metabolism often lowers blood pressure more sustainably than focusing on salt alone. The other major category is neurologic. That's how your nervous system sets the tone. Chronic sympathetic activation from emotional stress, poor sleep, chemical stressors, or structural problems raises renin-angiotensin-aldosterone system activity and sodium retention, pushing your pressure up. The good news, the nervous system is rewritable. Breathwork, paced breathing, meditation, heart rate variability training, and regular movement lowers sympathetic tone and often reduces pressure. If you want to know where you stand, measure to manage. The tests that doctors often recommend with patients include fasting insulin to detect insulin resistance. Number 2, CRP, that is an inflammation marker. Number 3, lipid particle number stroke LDL particle size rather than the total cholesterol alone. Number 4, LP and homocysteine where appropriate. It helps to detect cardiovascular risks. Number 5, basic metabolic panel to check kidney function and electrolytes. These markers give a deeper picture than a single blood pressure reading, and they point to targeted interventions. Alright, 3 practical moves you can start this week that help most people. Number 1, improve metabolic control. By that I mean, reduce refined carbohydrates and sugar, prioritize whole foods, increase protein and fiber, and include good fats. Those are olive oil, avocado, and fatty fish. And also, work with a clinician to measure insulin. Number 2, move daily and fix posture. 30 minutes of moderate activity most days plus mobility work to restore signaling. Movement improves insulin sensitivity and reduces sympathetic tone. Number 3, learn to downshift your nervous system. Start with 5 to 10 minutes of paced breathing, 4 to 6 breaths per minute, or guided meditation daily. Tools like HRV training or HeartMath can accelerate progress if you struggle to stay consistent. Let me be clear, medication saves lives. If your pressure is in stage 2 or higher, or you are at high risk of cardiovascular risks, medication may be necessary immediately and you should follow your clinician's plans, okay? My point is, medication is often best when paired with a plan to address metabolic and neurologic drivers so you can improve long-term outcomes and sometimes even reduce medication needs under medical supervision. In summary, genes are not destiny, epigenetics and habits matter. Number 2, kidneys pressure natriuresis system normally stabilizes blood pressure if it is failing. Look for metabolic or neurologic causes. Number 3, salt matters for some people, but metabolic health and stress wiring are often the bigger contributors. If this video helped, hit like, it really helps the channel. And tell me, which advice did your doctor give you that you now question? Drop in the comments, I will read them. Stay blessed. Bye.